Hello everyone, in this video we are continuing our series on substance abuse in pregnancy. So in this video we'll discuss about some miscarriage and uh, teratogenicity and fetal development problems with the substance abuses. Now let's start with the miscarriage. General view is what? That the substances like cocaine, opiates are abortive. But what the problem with this particular knowledge is the definitive evidence, like in the studies, is lacking. There are various compounding factors are also present, like malnutrition, poor hygiene, lifestyle should be maybe unhealthy. So all these co-founding factors are always there with substance abuses. So definitive study who actually gives the evidence of abortion or their abortive properties is not well documented, but still with the expert opinions it is well received that yes, these cocaine and opiates are having abortive properties. Now there are various studies with the alcohol. 2 drinks per day is associated with miscarriage, mildly associated with miscarriage, but the more than 6 drinks per day is very strongly associated with miscarriage of the pregnancy. So alcohol, when we consider alcohol, we have different kind of studies available. Now let's go with the teratogenicity and intrauterine growth problems with substance abuse. So this is very important and uh, very well known syndrome is fetal alcohol syndrome. Okay, so the fetal alcohol syndrome have 3 basic criterias. Which are these 3 criterias? The first criteria is prenatal postnatal growth restriction, either it is prenatal or a postnatal growth restriction or microcephaly. The second one is nervous system dysfunction, that means learning disability, intellectual impairment, ataxia, attention defects, all these things can present. Facial appearances of mild face hypoplasia, narrow palpebral fissures, small philtrum, ptosis, and low set of ears. All these 3 criteria are of fetal alcohol syndrome or FAS. Now, how you defined as a heavy drinking? Heavy drinking is more than 2 drinks per day or more than 45 drinks per month. With this heavy drinking, 4% of the fetuses are associated with FAS, that is fetal alcohol syndrome. If the lady is having more than 3 drinks per day, then the incidence increases very sharply, more than 4%. Okay, binge drinking is more harmful. So sometimes what the people think is binge drinking is not very harmful, chronic drinking is harmful, but it's not like that. Binge drinking is always very harmful, more harmful than chronic one. Benzodiazepine are associated with cleft lips. Cocaine, as far as cocaine is concerned, there are various studies available, and one of the very good study suggests that with the cocaine abuse, the birth weight decreases by 450 gram. This study is well known and compounding factors are removed. But what generally we think is with the cocaine, neurological maldevelopment is there, microcephaly can be seen, GIT, genitourinary system, limb defects can be present, preterm labor and placental abruption can be present because of the vasoconstrictive nature. Now, fetal alcohol, if we consider that that if the fetus is having more than 2 units per day, sorry, if the mother is having more than 2 units per day in last 3 months of the pregnancy, then the incidence of IUGR is 45%. So it's very dangerous. Now this was about development of fetus. Now let's talk about neonatal effect. The neonates which are born with the mother having substance abuses are associated with low Apgar score, infectious complication and CNS disturbances. The one of the very important syndrome is neonatal abstinence syndrome. And what is that? Neonatal abstinence syndrome appears in the babies whose mother are abuses opiate regularly. So once the baby is born, then the source of opium to the baby is lost. So the baby will be having withdrawal syndromes like irritability, hypertonicity, tremor, exaggerated startle response, sweating, sneezing, high pitch cry, poor feeding cooperation. All these things can be seen in this neonatal abstinence syndrome. Amphetamine exposed babies can also be hyperactivity, having poor feeding and disrupted sleep pattern. So this was all about various effect of various substances on the pregnancy, fetus and even in neonate. Thank you friends.